Moving on to this last section, we'll try to make it quick for those of you who are staying online. It's only rehabilitation. Rehabilitation requires a coordinated effort. As we all know, it's the orthopedic surgeon, the therapist, and most importantly, the patient family. The care can be broken down into essentially 3 phases, but really 4 phases. The prehab, the inpatient piece, which is broken into 2 sections, the acute care, the extended care, and the outpatient home care. The prehab has debate in terms of efficacy. It's involving physical therapy prior to the initiation of the arthroplasty and its effects. There's mixed results. Some results out of the Rubin Institute have stated that prehab has shown some efficacy, but other studies have suggested that there's no benefit to prehab prior to total knee arthroplasty. Pain management. Pain management involves the preoperative as well as the intraoperative. Preoperatively, people are utilizing anti-inflammatories and opioids to effectively block the pain receptors and hopefully reduce the postoperative pain management as well as improve patient outcomes and patient satisfaction. Intraoperatively, regional anesthesia, specifically spinal anesthetics, have been shown to have decreased morbidity to the patient and are preferred over general anesthesia. Peripheral nerve blocks such as femoral nerve blocks or adductor blocks have shown some efficacy. There you can see a question as it pertains to which type of block may be associated with quad shutdown, and clearly that would be the femoral nerve block and could affect the patient's postoperative rehabilitation, especially if they have an accelerated rehabilitation program. The para-articular multimodal injection is something that was popularized by Delanois. It talks about giving an injection around the periosteum of the total knee, decreasing the postoperative pain with minimal risk. As you can see depicted on the slide, on the bottom side of the slide, that can consist of bupivacaine, ketorolac, epinephrine, as well as normal saline. The inpatient acute care, again, postoperatively, it really involves multimodal drug therapy. That's the gold standard. Again, it uses opioids. As we all know in orthopedics, opioids have gotten a negative connotation in the literature. We're trying to move away from that. Anti-inflammatories such as COX-1 and COX-2s have been shown to be very efficacious in the postoperative period. The introduction of gabapentin as well as reduces the hyperexcitability of the voltage-dependent calcium channels and thus reducing the pain of the patient. As we all know, range of motion is important following the total knee arthroplasty. The things that you should know are those highlighted in blue. During swing phase, it's considered 65 degrees for normal swing phase. Activities of daily living, minimum of 90 degrees, though that's debatable, but 90 degrees is the answer if asked. Stair climbing, for the average 8-inch step, it requires 95 degrees of flexion, and rising from a standard chair on the average height of an individual is 105 degrees, but can be greater with a taller individual. The use of CPMs has shown to improve range of motion in the early postoperative period, but has not shown any increased benefit in the long-term effects. In regards to discharge to home, these are really Medicare and Medicaid criteria: medically stable, a functional range of motion, as well as the ability to ascend and descend steps. There has been an emphasis on sending patients home earlier, and as we know in the newer literature, the results of patients going home versus those going to an inpatient rehab have not shown increased morbidity or have shown a decrease in patient satisfaction. Physical therapy focuses on the closed chain exercises. What's important in this slide here is the cryotherapy. Cryotherapy is cold therapy. It has been shown to improve range of motion in the immediate postoperative period, and that's probably secondary to modulating the pain threshold or improving the pain of the patient. In this slide, what's really important here is the emphasis of driving recommendations. An article out of Baltimore by one of our surgeons states that when you're looking at the rate of return of the rate of muscle contraction, the patient returns back to normal speed at about 4 weeks. So for a person with a right total knee, 4 weeks is a recommendation. For a patient who is undergoing a left total knee arthroplasty, it's less than 4 weeks. So going to our first question, which of the following statements regarding CPM device is true about total knee arthroplasty? And the answer, as we know, is the use of CPM does not demonstrate any difference in clinical outcomes at 1 year. Also important to note that someone can ask, is it associated with increased flexion contracture? No. Does it have an increased incidence or decreased incidence of manipulation? And the answer is no. Another question, cryotherapy has been demonstrated to achieve what effect on total knee arthroplasty? Again, I'm not really crazy about this question. The answer is improved range of motion at the time of discharge, and that's probably secondary to the improvement in pain, swelling, and analgesia. But for the purpose of the SAE question, the correct answer is number 3, improved range of motion at the time of discharge. Another question, here's a 68-year-old gentleman who has severe osteoarthritis, as shown in figure A. He's interested in producing a total knee arthroplasty. He wants to know what he can expect from his golf game following the procedure. Here's a radiograph showing severe end-stage arthritic changes, and the answer is a significant rise in his handicap, and that's somewhat self-explanatory. He will develop increased range of motion, increased rotation, and decreased pain, and thus there's a significant increase or a significant rise in his handicap, and that work was done by Dan Berry out of the Mayo Clinic.
If you enjoyed this video, please consider leaving a like. We'd love to hear your thoughts and what you'd like to see next in the comments. Don't forget to subscribe to our channel and follow us on social media.